We're going from paying about $8,500 a year for our health insurance to paying around $30,000 a year. And when you add to that high deductible, that $10,000, that means that we have to set aside $40,000 a year just to cover our health insurance.
Hi, this is Congressman Joe Courtney. I'm in the Mystic section of Groton, Connecticut, in the 2nd Congressional District from the state of Connecticut. And I'm here today with Lee Burdett Williams, who is, invited us to her home to talk about really one of the central issues of the impasse that our country is facing in Washington. And that issue is whether or not the spending plan, which is being contested right now, is going to include extension of the enhanced premium tax credits, which is a way to make health insurance affordable for tens of millions of people all across the country. And Lee, thank you for the invitation to stop by here, and thank you for reaching out to the office. And maybe you could sort of describe your experience with the enhanced premium tax credits in the health insurance that you have today in calendar year 2025.
Sure. My spouse and I have both spent a career working in higher education. We always worked for employers who were able to provide us with health insurance coverage. This year, we find ourselves both working for nonprofits, neither of which are providing health insurance coverage for us. And in making the decision around how we would approach our employment situation, part of the calculus was, can we afford health insurance? And what would that look like? And so we did our research, and we got some help from a health plan advisor, and looked at the plans that are available through the exchange. Settled on a bronze plan with Anthem, so not top of the line, but a plan that we felt with our relatively good health and age would work for us. That plan is about a $700 a month premium, and when you look at the plans and compare them, you see this is what the premium tax credit, the subsidy is. And so for us, that was showing at about $2,200, or I guess around $2,000 of premium tax credit. So we would be on the hook for $700 a month, but that was going to buy us a plan that ultimately would cost about $2,700 a month if we were buying it separately, independently. So that's a manageable amount for us. Again, we work for nonprofits, so we don't have a sizable income. And then things began to unravel, I think, and we started to realize that the potential that was talked about last March, that premium tax credits would expire in December, was starting to look more and more realistic. So we kind of went back and did the math and realized that we would have to be paying, starting in January, a health insurance premium of about $2,700 a month. And that's essentially about 30 to maybe 40% of our take-home salary. So not really an affordable option with our current salary. We know that we can dip into our retirement savings to make those payments, and we feel really privileged that we're able to do that, but we also are really discouraged because we've spent our lives being pretty careful, saving our money, planning for retirement, and so to have that money now tapped for something like health insurance is really going to impact us long term. And we felt like we needed to say something, so one thing that we did was send a letter to you and to our senators just expressing our real fear about what was going to happen, not just to us, but to a lot of our neighbors who maybe don't have those retirement dollars to tap.
Right. So again, you're absolutely right. I mean, this is an issue which actually has a huge impact. About 24 million people nationally are enrolled in exchanges in the 50 states and the territories that are out there. And the impact in terms of losing those enhanced tax credits is going to create the biggest sticker shock in healthcare in memory, which is really saying something. Again, to have your monthly premium go from $700 a month, which, again, for a lot of people, it's important to emphasize these are not free health plans by any stretch.
No.
You've got a high deductible on top of that.
Right, $10,000 deductible a year.
But to then see it jump to 2,700, and again, we're not really gonna know the exact numbers probably for another 10 days or so when the exchange sends out the postings that will trigger the enrollment period, which starts in November 1st,
Right.
and that's happening here. So, and again, I think that, for anyone listening, it's just, the notion that you have to tap into your retirement savings, which, by the way, is a taxable event,
Yeah.
and you have to pay tax
Yeah.
on that because that's not an allowable use
Right.
of 401k funds, is just, completely sort of perverse in terms of just, what, health insurance, affordable health insurance, really should protect you from in terms of,
Right.
having to, stretch beyond, what your income allows that's there. So, right now, this is really the issue of the day in terms of this impasse that's happening down in Washington. And I appreciate you stepping forward and talking about this because, one of the myths that the administration is putting out is that, this is an issue that can wait until January of next year. But as I said, you're obviously already watching the calendar, right? In terms
yeah.
of just when some tough decisions are gonna have to be made.
Right, yeah, as we've done the math, we're going from paying about $8,500 a year for our health insurance to paying around $30,000 a year. And when you add to that high deductible, that $10,000, that means that we have to set aside $40,000 a year just to cover our health insurance. And again, I feel like I have to sort of emphasize that we're in a fortunate position in that we do have some funds to use for that, although with a tax liability. We just worry a lot about people who don't have that and who are going to make the choice to go without health insurance. We wouldn't make that choice. I think we're both pretty committed to being conservative that way. But a lot of people, a $30,000 deduction from their annual salary is just not affordable. It's going to be a difference between feeding their children and paying for health insurance. And as people who are really committed to our neighbors in our town, we just feel like this is terrible. It's a terrible situation for people to be in.
So again, there's a very simple way to resolve this, which is to recognize that these enhanced tax credits, which this would be year 5 of those tax credits going into effect if we extended them into 2026. If that was included in the spending plan, which will keep the government open, which in all honesty, if you're going to describe it as a continuing resolution, then we should continue the coverage that's on the books today. Then this impasse will be solved really with almost the stroke of a pen because it's that simple to do that. And but again, I think it's very powerful for you to describe it in your own personal terms, in your spouse's terms, that this is going to have a real impact on real people. And on Friday, when we were in Hartford, the exchange which runs the program was talking about the fact that there's clients who are in the middle of cancer treatments, who are now expectant families, and then suddenly they're looking at a cutoff, at the end of December.
Right.
If they get hit with 400, 500% increases.
People with chronic illnesses, people who rely on medication to stay healthy and alive, they're going to take the hit. And honestly, when I think about our representatives in Washington, I can't wrap my head around the idea that they are not seeing what this is going to do to the people who either voted for them or didn't vote for them, but they're still responsible for. It's really heartbreaking.
We're going to do our best to make sure that they see this video because I think it's going to be a very powerful message, and you're not alone. This is happening in other parts of this district, in other parts of the state, and other parts of the country. So thank you for taking the time to share your story.
Well, I'm really happy to have the opportunity and grateful for your willingness to hear us out.
Great. Thanks, Lee.